You know, many health professionals on the front lines, they're the ones battling the COVID-19 pandemic. And one urgent care doctor here in New York City says he contracted the virus, now wants to urge people why it is just so important to continue to stay home to flatten this curve. Joining us right now is Dr. Jake Deutsch, founder of Cure Urgent Care, to share his unique experience as a doctor and patient during this time. So good morning to you, doctor. Thank you for joining us. First and foremost, how are you feeling this morning?
I'm feeling pretty good.
Oh,
yeah, there you go. A little technical difficulties.
So, there you go.
But
no worries. We're working through it, my friend. So tell me first about your symptoms and when you first realized, okay, maybe I contracted this.
Sure. I was working, seeing patients, a lot of people that had flu-like illness. And basically, I started to get fever, body aches, the typical symptoms of corona. And I kind of experienced what I thought was corona, but we didn't have testing. And so luckily we were able to get testing pretty quick, made the diagnosis on myself, and started to recover with what I thought was going to be a normal illness. About 5 days of fevers and body ache. Sorry?
No, did you assume, I'm sorry to cut you off, did you assume that you contracted this because of where you work and what you do for a living, being a doctor treating patients? Was it that you didn't have enough personal protective equipment?
Yeah, nobody really knows because we were seeing patients that we thought had corona before there was testing. And there was no information that was important about using PPE the way that we know it now. And so, this could have been from work or it could have been from the subway. We're in New York City.
So you obviously, yeah, and that's the thing. The community spread happened so quickly here. So you're back to feeling 100%. You are back now on the front lines. What are you seeing when you go to work each and every day now?
About 90% of the patients are related to corona illness. So testing a lot of people who are first responders, doctors, nurses, fire department, and police personnel that don't have access to testing. They're being told that they need to go to work. They're having symptoms that are significant. And we're really keeping them healthy, giving them the information that they need, making sure that people are able to help, but also not hurting other people.
Yeah, and I think, a big part of this is anxieties are so high, worry that if you contract this, on a scale of 1 to 10, where would you rate 1 being the worst, 10 being the best? Where would you rate exactly where you fell on that spectrum of your symptoms? And what's your advice to people about recovery and once they start feeling better?
Yeah, I would say that it was probably a hard 7. I actually had pneumonia. I was sick for 2 weeks. It really knocked me out. This was not a flu. This was something that was probably the worst health experience of my entire life. So, I definitely have a different sense of perspective.
Is this your chest X-ray that we're looking at?
Yeah, that's my actual X-ray where you could see pneumonia on both sides. We call that a bilateral pneumonia. So that made me pretty scared as a clinician.
So we're looking at this shot right here.
Yeah, sorry.
I just want to explain this, what we're looking at on your screen. Go ahead. Yeah, so we see the lungs, right? The black would be what versus the white spots that we're seeing? Like the black, I'm assuming, is air for a healthy lung, right?
Right. And then in the lower part, you're seeing some of the white spots on both sides. So that's indicative of a pneumonia that we call bilateral. And usually that means somebody needs to be admitted to the hospital.
So what kind of advice would you give people after they've had this virus, they're recovering now at home? What's the time frame for when a person could actually, in your opinion, go back outside, even if they test negative, right? Because I'm seeing people on social media say, okay, I tested negative, but I still am worried about going around people or going back to work.
Sure. In general, if you're a healthcare professional, you got about a week from the onset of symptoms and 3 days without fever before you're good to go back. For the general population, we're telling people 2 weeks from the onset of symptoms that you should be quarantined. And my advice for everybody is, a little bit of patience. Most people are going to get better. Most people have mild symptoms. So make sure that you're giving it adequate time to understand that you are improving and not to get overly concerned because you are having lingering symptoms because some people have 14 days. But certainly severe symptoms like difficulty breathing, chest pains, those are indications that you might need to seek medical care. And certainly places like urgent cares are useful resources so people aren't going to the hospitals.
Yeah, obviously. Hey, I appreciate what you're doing on the front line. So many of the doctors. I'm sure you've heard the cheers for you at 7 p.m. every night in New York City. It's a round of
It's
applause for all
amazing.
those on the
But
front lines. It
it's
is
not just
amazing.
the
What you're doing is
doctors.
amazing.
It's all of the healthcare workers. It's the medical assistants, the people that do the clerical work, the housekeepers. This is a combined effort. So everybody deserves those applause.
Absolutely. I agree with you 100,000%. I'm glad you are feeling better. Thank you for your continued service as well and for joining us this morning with your perspective, Doctor. I appreciate it.